The president's budget makes a down payment, and he has used this word, on a long-run reform of the whole health system. There are basically two problems with our system. It's inefficient and costly, and the costs are rising very rapidly. That's one problem. And the other is there are a lot of people who don't have adequate health insurance coverage, and there are more every day because when people lose their jobs, they often lose their health coverage. So the president is trying to address both of those problems, or at least to make a start. The budget takes some quite aggressive stands on efficiency. It says that we're going to have electronic records. We're going to analyze those records and see what treatments work and what don't. We're going to make Medicare more effective by doing competitive bidding for Medicare Advantage plans. I think that's a no-brainer, but it may be difficult to get through the Congress. And the government are not going to use Medicare money to pay for hospitals that are readmitting the patient right away. I mean, that sounds like they didn't keep them long enough and didn't do the right things. So they are going to readjust the reimbursement rates for Medicare so that it covers an episode of illness, and the hospital is responsible for solving the problem. I think this is the right approach, but it's difficult and it's going to take time. At the same time, the budget and the stimulus package which preceded it take a couple of steps toward broadening coverage, toward making sure that people who lose their jobs have affordable health insurance. But it does not propose a new structure for the health system. That, he says, we will work with Congress to do that, and I think that's the right thing to do. We in the Clinton administration made the mistake of writing a very elaborate, complicated plan and shipping it up to the Congress, and then it didn't get a very good reception. It went down. But I think this administration wants to avoid that mistake. They want to work closely with the Congress. Now, that doesn't mean they're not going to have ideas, but they aren't tipping their hand right now as to what this negotiation is going to look like from their side. One has to ask, how is this big investment in health going to be paid for? And there are basically two answers to that in the budget. One is the increase in taxes on upper income people is going to go into that fund. That will pay for about half of it. And the other, the president hopes, the other half will come from the eventual savings from these stronger rules about efficiency and not paying for wasteful care.